I'm Subir Bhatia. I'm a second-year medicine resident at Mayo Clinic in Rochester, and I have with me today Dr. Kapa, who's an electrophysiologist at Mayo Clinic. Welcome.
Thanks, Subir. It's my pleasure to be talking to you today.
So, we were interested, what advice would you have for trainees who are interested in cardiology, who are currently in a medicine program?
So, cardiology has become increasingly complex because it's almost like cardiology encompasses the whole of really medical school in general in terms of deciding what you want to do. You can be anything from an interventionalist who is extremely invasive, almost akin to a surgeon, all the way down to a radiologist who primarily focuses on cardiac imaging. So I think the problem a lot of medicine residents have is when they chose that field, they were thinking about clinic days and seeing patients and complex decision making. And now you're being asked to go into a field which has essentially every facet of everything you can think of when you were back in medical school. So I think the biggest thing is exposure. Thinking about the types of things you enjoy doing, use that medical school basis, use that basis of what you've been exposed to in residency, and ask yourself, all right, what is a scene that catches my interest? What do I like to spend my day as? Do I like to spend my day operating? Do I like to spend my day talking to people? Do I like to spend my day thinking about the most complex cases possible? Or just trying to enact therapies for something I know what's going on, I know what the pathophysiology is? And getting exposure by going into the clinic, going into the labs, even if your rotations don't exist for it, just getting exposure by talking to those relevant people is going to be one of the best ways of figuring that out. And the last thing is really research, which I know you and many of my residents and fellows have gotten involved in at Mayo, has helped them kind of envision the career that they want in the area that they want.
That's great. What advice as far as research, how to go about finding a project and, if you could just speak on that issue.
So there's a lot of things that go into finding a project. The biggest thing people look for is a good mentor. Mentorship is important, but you also need to think about what you enjoy. I always tell people doing a project for the sake of doing a project isn't enough. You actually have to have some interest, some drive about why you're looking at the thing you're looking at, because otherwise it just doesn't get done. Otherwise it's a task as opposed to an interest. And that's going to help you be successful in it when you're actually interested in it. The other thing when residents or fellows or frankly even junior faculty go out there and look for new mentors is the one thing that we are not as very good at as mentors sometimes is teaching people how to say no. That you don't have to do everything somebody puts in front of you. And then sometimes by doing it all, it's going to take away from the opportunities to explore the things you really enjoy. You get burned out or you're not as good at the things you were trying to achieve. So trying to go through things, even if you started something, being able to think about it and say, this was an interesting project, but it's taking away the time I need to be successful at these other major areas I'm involved in. Maybe I can engage somebody else. Maybe I can work with my colleagues who have shared interests. So it's about finding the right mentor, finding the right project and type of project, and what are you going to get out of the project? You have to look beyond, is it a paper? Is it a line on my CV? Am I going to get something more out of it in the way of knowing a new skill or being able to actually understand a concept better? And it's not a bad thing to take on a project just to get a line in your CV. I mean, the reality is, even though it's like the thing that most people don't talk about, the reality is it's what many of us did. But that being said, you have to think about how much time you have and how you're going to use that time as well.
And for more videos like this, please visit youtube.com/FITsontheGO.